You are listening to Module Number 4, Medicaid Basics, Training for Indiana Navigators.
Module number 4 provides an overview of the Indiana Medicaid programs. Upon completion of this training, you'll be able to assess whether someone might be eligible for an Indiana Medicaid program. You'll be able to explain to a consumer what information is needed to complete an application, and also explain their options for health coverage through the state. Finally, you'll be able to help a consumer know what to expect after an application has been filed. Medicaid is a health coverage program funded jointly by the state and federal government. It provides free or low-cost health insurance coverage to individuals who meet the state's eligibility criteria. This eligibility criteria is developed by the state within the parameters allowed by the federal government. In general, Medicaid coverage is available to low-income children, pregnant women, parents and caretaker relatives, and the age, blind, and disabled. Indiana Medicaid offers a variety of programs. Eligibility criteria such as income, resource, or age limits vary by eligibility category. Indiana Medicaid operates several different programs which have been developed to address the medical needs of the target populations they serve. Collectively, these programs are referred to as the Indiana Health Coverage Programs, or IHCP. As of 2013, Indiana's IHCP programs included Hoosier HealthWise, the Healthy Indiana Plan, Care Select, Traditional Medicaid, MedWorks, Home and Community-Based Services Waivers, the Medicare Savings Program, Family Planning Eligibility Program, Spend Down, and the Breast and Cervical Cancer Program. Each program has different criteria for eligibility, and we'll be walking through each of the programs in further detail. Hoosier HealthWise is Indiana Medicaid's program for low-income families, pregnant women, and children under 19. For children under 19, the Hoosier HealthWise program covers individuals who are eligible for either Medicaid or the Children's Health Insurance Program, known as CHIP. Medicaid was created for children of low-income households. CHIP is available to individuals whose family income is too high to qualify for Medicaid. Under the CHIP program, families must pay monthly premiums for coverage. In order to qualify for the Hoosier HealthWise program, an individual's monthly income must fall below a specified dollar amount. These income limits vary based on whether an individual is a parent or caretaker relative, child, or pregnant woman. The dollar amounts which are expressed on this slide are for eligibility effective as of January 1st, 2014. For children and pregnant women, these dollar amounts are updated on an annual basis, as they are based on the federal poverty level, or FPL, which are updated on an annual basis by the federal government. In order to qualify as a parent or caretaker relative for the Hoosier HealthWise program, the applicant must live with a child under the age of 18 and be primarily responsible for the child's care. To be a parent or caretaker relative, an individual must be a parent, step-parent, grandparent, sibling or step-sibling, aunt or uncle, first cousin, or a nephew or niece of the dependent child for whom they're primarily responsible. To qualify as a child for Hoosier HealthWise, an individual must fall under 250% of the FPL. These dollar amounts are expressed on this slide and vary by family size. For children who are above 158% of the FPL, or $1,514 for a family size of 1, these children will qualify for Hoosier HealthWise under the Children's Health Insurance Program, or CHIP, and therefore have a monthly premium responsibility. For pregnant women, as of January 1st, 2014, the income limit for this eligibility group is 208% of the FPL, as illustrated on this slide. In determining the household size of a pregnant woman, her unborn child is counted. Therefore, if she lives with no other individuals who are applying for coverage, her family size is automatically 2. The Healthy Indiana Plan, HIP, provides low-cost health insurance to uninsured Hoosiers. In order to qualify for HIP, an individual must be between the ages of 19 and 64. Effective January 1st of 2014, in order to qualify for HIP, an individual's income cannot exceed 100% of the federal poverty level. This is $957.50 per month for a family size of 1. The Healthy Indiana Plan provides a basic commercial benefits plan. HIP enrollees have a power account, which is valued at $1,100 per adult to fund the $1,100 annual deductible for the program. Contributions are made to the power account by both the state and participant. Participants contribute up to 2% of their monthly income to the power account. Employers and nonprofits may also help an individual with this 2% contribution. Additionally, the HIP program provides $500 in preventive services which are covered by the state. Preventive care includes services such as annual exams, smoking cessation, and mammograms. HIP enrollees have no other costs for their HIP coverage, with the exception of copayments for non-emergency use of the ER. Individuals in the Hoosier HealthWise and Healthy Indiana Plan are enrolled with a managed care entity. Managed care entities are health insurance companies with whom the state contracts to administer the HIP and Hoosier HealthWise program. Currently, the state contracts with MedWise, Anthem, and MHS. Hoosier HealthWise and HIP applicants select a managed care entity at the time of application. If they do not make a selection on their application, they have up to 14 days after enrollment in the program. Individuals who do not make a selection within this 14-day period will be automatically assigned to one of the managed care entities. They will still have the opportunity to make a change if they've been auto-assigned to one of the plans. After an individual is enrolled in a managed care entity, they also select a primary medical provider known as a PMP. Individuals see the primary medical provider for all of their care and receive referrals to any specialty care from the PMP. Managed care entities provide a variety of services to individuals in the Hoosier HealthWise and HIP programs. This includes services such as case management and disease management, as well as operating member services helplines in order to address any questions or complaints that an enrollee has. The Care Select program is for Indiana Medicaid enrollees with special health needs or chronic conditions. In order to be eligible for Care Select, an individual must be aged, blind, disabled, a ward of the court, foster child, or a child receiving adoption services or assistance. Additionally, an individual must have a qualifying condition in order to be enrolled in the Care Select program. These conditions include asthma, diabetes, congestive heart failure, coronary artery disease, chronic obstructive pulmonary disease, hypertension, chronic kidney disease, serious mental illness, severe emotional disturbance, or depression. The Care Select program provides care coordination and management and disease management. Individuals are enrolled in Care Select after being found eligible for the Indiana Medicaid program and after it's determined that they have one of the qualifying conditions. Enrollees select or are assigned to a care management organization which oversees and coordinates all of their care. Additionally, they select or are assigned to a primary medical provider which provides the direct health care services to the individual and provides all referrals to specialty care. As we've seen on the previous slides, individuals in the Hoosier HealthWise, HIP, or Care Select program receive all their services through primary medical providers that are contracted with the managed care entity or care management organization. Under traditional Medicaid programs, enrollees can seek care from any Medicaid provider. Individuals who are enrolled in the traditional Medicaid program include age, blind, and disabled enrollees who either do not qualify for the Care Select program or have opted out of the program. Additionally, it includes individuals who are eligible for both Medicare and Medicaid. These are referred to as dual eligibles. Individuals who are residing in a nursing home or another institution and individuals receiving hospice services are also in the traditional Medicaid program. MedWork enrollees, which we'll talk about in further detail in a moment, are also in the traditional Medicaid program. Individuals receiving home and community-based services waivers and individuals who are Medicaid eligible due to having breast or cervical cancer are also enrolled in traditional Medicaid. Children who are in psychiatric facilities or are receiving Title IV-E foster care and adoption assistance also enroll in the traditional Medicaid program. Finally, refugees who do not qualify for another aid category are eligible for traditional Medicaid and can seek care from any Medicaid provider. This includes individuals who are receiving refugee medical assistance. Medicaid for employees with disabilities, known as the MedWorks program, provides Medicaid coverage to working people with disabilities. In order to qualify for MedWorks, an individual must be between the ages of 16 and 64 and fall below 350% of the federal poverty level. An individual must be disabled and have assets below a certain limit. For single individuals, this asset limit is $2,000, and for couples, the asset limit is $3,000. Although there are these asset limits, MedWorks participants can put up to $20,000 in an account known as a Savings for Independence and Self-Sufficiency account. This is an account that allows individuals to put aside money to purchase goods or services that will help them find or retain a job. Additionally, in order to qualify for MedWorks, an individual has to be working. There is no minimum qualifying criteria for what is considered working in the MedWorks program. For example, there's no minimum hour requirement that's associated with that criteria. Individuals who are eligible for MedWorks receive full Medicaid benefits. They can have employer-sponsored insurance, but Medicaid would serve as a secondary payer. Individuals who are in the MedWorks program have a monthly premium responsibility. These premiums are outlined on the table on this slide and vary based on an individual's income and whether they are single or married. These monthly income amounts are based on the 2013 FPL and will be adjusted on an annual basis. Home and community-based services waivers are designed to provide an array of services to enrollees in order to prevent institutionalization. The goal is to keep an individual in a home and community setting and avoid the need to go to an institution. In order to qualify for a home and community-based services waiver, an individual must have income less than 300% of the Supplemental Security Income, SSI benefit. This is $2,130 a month as of January 1st of 2013. This dollar amount is updated on an annual basis. If the applicant for waiver services is under 18, when their eligibility is determined, their parents' income and resources are not considered. In addition to these income requirements, an individual must meet the level of care for the waiver. A level of care is the minimum need an individual must have to be considered eligible for the waiver. The Medicare Savings Program helps low-income Medicare beneficiaries pay for their out-of-pocket Medicare costs. In order to be eligible for the Medicare Savings Program, an individual must be eligible for Medicare Part A. There are 4 different potential categories that an individual may be eligible for, and these eligibility categories offer different benefits and have different income thresholds. First is the QIMBY category. In order to qualify for QIMBY coverage, an individual must fall below 100% of the federal poverty level. Additionally, they cannot have resources over $7,080 for a single individual, or for a couple, $10,620. Individuals who qualify for QIMBY have their Medicare Part A and B premiums paid by the state, as well as any Medicare cost sharing, including copays, deductibles, and coinsurance. Individuals who are eligible for QIMBY may also qualify for full Medicaid coverage, but under the QIMBY program would have their Medicare cost sharing paid for. Individuals who fall between 100% and 120% of the federal poverty level qualify for the SLIMBY program. Their asset limits are the same as we saw for the QIMBY program. What differs between QIMBY and SLIMBY is these individuals have coverage only for their Medicare Part B premiums versus their additional Medicare cost sharing, such as copays, deductibles, and coinsurance. Individuals who are eligible for the SLIMBY program may also have full Medicaid coverage. Individuals may be eligible for the QI program if their income falls between 120% and 135% of the FPL. Under this program, they would have their Medicare Part B premiums paid for. Individuals eligible for the QI program cannot qualify for another Medicaid category. Finally, the QDW program is available to individuals who lost Medicare coverage due to their working status. Individuals can have income up to 200% of the FPL, and the state would pay for their Part A premiums. Indiana's Family Planning Eligibility Program provides men and women with family planning services. In order to qualify for the program, an individual cannot qualify for any other Medicaid category. As of January 1st, 2014, to qualify for the program, an individual must have income less than or equal to 141% of the federal poverty level. This is $1,351 per month for a family size of 1. In order to qualify, an individual cannot be pregnant, have had a hysterectomy or sterilization procedure. Examples of covered family planning services include annual family planning visits, oral contraceptives, devices and supplies, any follow-up care for complications associated with these methods, as well as lab tests, ligations, and vasectomies. The Spend Down program is designed for individuals whose income is too high to qualify for Medicaid, but they meet other Medicaid criteria due to being aged, blind, or disabled. The Spend Down program operates similarly to a deductible. An enrollee receives health care services and is responsible for the cost of their care received until they meet their maximum out-of-pocket amount for the month or their spend-down amount. After this monthly spend-down amount has been met, Medicaid begins covering any other health care that is received for the month. Once the month ends, the process begins again, and the individual must meet their spend-down amount on a monthly basis in order to receive Medicaid coverage for services. The Breast and Cervical Cancer Program provides Medicaid coverage to women with breast or cervical cancer. Individuals diagnosed through the Indiana State Department of Health Breast and Cervical Cancer Screening Program qualify for this program. Additionally, individuals between the ages of 19 and 64 who are not otherwise eligible for Medicaid and have income less than 200% of the federal poverty level, which is $1,915 per month for a family size of 1, may also qualify for this coverage if they're in need of treatment for breast or cervical cancer and have no health insurance that covers their treatment. We've now walked through all of the current Indiana health coverage programs. We're going to briefly recap who's eligible for which program, what the associated income limits are, any age requirements or other requirements associated with eligibility for these programs. To begin, The Hoosier Healthwise program, again, covers children, low-income families, and pregnant women. Children who fall below 250% of the federal poverty level and who are between the ages of 0 to 18 will be eligible for the Hoosier Healthwise program. Additionally, children who are 19 to 20 years old who would qualify for TANF, the Temporary Aid to Needy Families program, with the exception of their age, may also qualify for Hoosier Healthwise. The monthly income limits by family size are listed on this slide. Former foster children are also eligible for Hoosier Healthwise. This includes former foster children who are between the ages of 18 to 21 and have income up to 210% of the federal poverty level. Additionally, as of January 1st of 2014, the Affordable Care Act added a new mandatory eligibility group. This is for former foster children who are between the ages of 18 to 25 and who were enrolled in Indiana Medicaid as of their 18th birthday. Parents and caretaker relatives may also qualify for the Hoosier Healthwise program. They must be a parent or caretaker of a dependent child and have monthly income that falls below the threshold listed on this slide. Finally, pregnant women are also eligible for the Hoosier Healthwise program when they are pregnant and have income up to 208% of the federal poverty level as of January 1st of 2014. A variety of individuals are eligible for the Indiana Medicaid Traditional Medicaid program. This includes children residing in a psychiatric facility. They must fall below the income limits based on family size listed on this slide, be between the ages of 19 and 21, and inpatient in a Medicaid certified psychiatric facility. Additionally, children receiving adoption assistance or foster children under the age of 19 also may qualify for traditional Medicaid. Individuals who are considered aged, blind, or disabled who either do not qualify for Care Select or opt not to enroll in the voluntary program would also be enrolled in the traditional Medicaid program. To qualify, their income cannot exceed $1,066 a month for married couples or $710 a month for unmarried couples or those who are not living with their spouse. If an individual's income exceeds this amount, they can qualify for Medicaid through the spend-down provision. Aged individuals are considered those over the age of 65. In order to be considered blind or disabled, an individual must meet the definition for blindness or disability or receive SSI or SSDI for blindness or disability. Additionally, home and community-based services waivers are available for individuals up to 300% of the SSI benefit and who meet the level of care for the associated waiver. The breast and cervical cancer program is for individuals up to 200% of the federal poverty level who are between the ages of 18 to 64 and have been diagnosed with breast and/or cervical cancer. These individuals cannot qualify for any other Medicaid category or have health insurance that covers their cancer treatment. The MedWorks program is for individuals up to 350% of the FPL who are between the ages of 16 to 64, are working, and meet the definition for disability. Finally, the traditional Medicaid program are refugees, which fall under the income limits described under this slide. Individuals who have income which exceed this amount may also qualify through the spend-down provision. The Healthy Indiana Plan is available for adults whose income falls below 100% of the federal poverty level and who are between the ages of 19 to 64. Care Select is available for aged, blind, disabled, and wards of the court, and also have a qualifying medical condition. The Family Planning Program is available for individuals whose income is up to 141% of the FPL and who do not qualify for any other Medicaid category. Finally, the Medicare Savings Program offers 4 different eligibility categories based on an individual's income and provides coverage for Medicare cost sharing. When we walked through each of the different IHCP programs, we saw that there was specific eligibility criteria associated with each of the different programs. In addition to those specific eligibility criteria, there are eligibility factors that apply across the programs. We're now going to begin discussing the general Medicaid eligibility factors, as well as the verification requirements for these factors. In order to qualify for Medicaid, an individual must meet the age and income standards associated with their eligibility group. For all categories, individuals must be a resident of the state of Indiana. They must fall under a eligible citizenship or immigration status, which we'll discuss in further detail. They must provide their Social Security number, provide information on any other insurance coverage, and file for other benefits. To be eligible for Medicaid, an individual must be a U.S. citizen, a U.S. non-citizen national, or an immigrant in a qualified immigration status. Immigrants who are not in a qualified immigration status are eligible for emergency services only. Lawful permanent residents who entered the United States after August of 1996 are eligible for emergency benefits only. These lawful permanent residents become eligible for full Medicaid benefits after 5 years. Individuals attest to citizenship and immigration status on the Indiana application for health coverage. Electronic data sources are reviewed, and if the individual's status is not verified electronically, paper documentation is required. There are some exemptions for individuals who do not need to verify citizenship. This includes Medicare enrollees, foster care children, individuals who are receiving SSI or SSDI, or deemed newborns. Deemed newborns are newborns with a mother who's enrolled in Medicaid. Individuals applying for Medicaid must supply a Social Security number. There are a few exceptions to when a Social Security number does not need to be provided. This includes cases when an individual is not eligible to receive a Social Security number, or may only be issued one for a valid non-work reason. Individuals who refuse to obtain Social Security numbers due to well-established religious objections are exempt, and individuals who are only eligible for emergency services due to their immigration status. Deemed newborns must not provide a Social Security number, as well as individuals who are receiving refugee cash assistance and are eligible for Medicaid. And finally, individuals who have already applied for a Social Security number and are waiting for the issuance of the number. Individuals must apply for any other benefits for which they may be eligible. This includes, but is not limited to, pensions from local, state, or federal government, retirement benefits, disability benefits, Social Security benefits, veterans benefits, unemployment compensation, military benefits, railroad retirement benefits, workers' compensation, and health and accidents insurance payments. Medicaid applicants may have other health insurance coverage. However, individuals cannot be eligible for the Children's Health Insurance Program or Healthy Indiana Plan if they have other insurance. For CHIP, if a child had health insurance and voluntarily dropped it, they may not receive CHIP coverage for 3 months following the month that coverage was dropped. This is referred to as the waiting period. Applicants must provide information about other insurance at the time that they apply. Additionally, once eligible for one of the Indiana health coverage programs, they must report changes in insurance status. Medicaid enrollees must use all other insurance first. Medicaid pays for costs that are left over after other insurance is paid. It is the payer of last resort. The Affordable Care Act impacted Medicaid in a variety of ways. Primarily, with the changes under the ACA, There are changes to how income and households are calculated for some eligibility groups. Additionally, there will be coverage provided to select newly required eligibility groups. The Affordable Care Act implemented Modified Adjusted Gross Income, or MAGI, methodologies. MAGI is a new income methodology to be used by all state Medicaid agencies and the federal marketplace to determine eligibility for Medicaid and tax credits. To comply with the ACA requirements for MAGI, Medicaid will change the way it counts the number of people in a household, will change how income is counted, and how assets are considered for Medicaid eligibility effective as of January 1st, 2014. For individuals who apply for Medicaid beginning in October of 2013, they will have their eligibility reviewed based on the current eligibility rules. If they're found ineligible based on these current rules, the MAGI rules will be applied to their case to determine if they may be eligible for January 1st, 2014 eligibility effective dates. For current Medicaid enrollees and those who are approved before Medicaid before December 31st of 2013, the MAGI rules will not be applied to their case until their first scheduled redetermination or after they report a change. Additionally, there are some groups who will be exempt from MAGI methodologies. This includes individuals who apply for Medicaid on the basis of being aged, blind, or disabled, as well as a few other categories which we'll describe in further detail in a few slides. MAGI is a methodology based on federal tax rules for income counting and determining household size. While based on tax rules, MAGI is not simply a number found on an individual's tax return. MAGI differs from current Medicaid eligibility rules in a number of ways. Today, what is counted as income is not defined by what is taxable or non-taxable income. Under MAGI methodologies, taxable income will generally be counted as income and non-taxable income. Today, the state disregards or does not count certain types of income. For example, the state excludes $50 of monthly child support income received. Under MAGI methodologies, these income disregards will no longer be applied. Rather, expenses that are tax deductible are deducted from income. Additionally, if an individual is found ineligible under MAGI, a 5% FPL disregard will be applied to see if the application of the 5% FPL disregard renders them eligible. For example, as previously discussed, the income threshold for CHIP is 250% FPL. If an individual's income is found to be 255% FPL, they would be found CHIP eligible, as the 5% FPL disregard brings their income to 250% FPL, which falls within the income threshold for CHIP. Under current eligibility rules, for some groups, an individual can't have assets that exceed a certain limit. Assets are items such as bank account balances or stocks. In 2014, for individuals whose eligibility will be determined based on MAGI, asset limits will no longer apply. In addition to changing what income is counted or how income is counted, MAGI changes household composition rules. Household composition rules refer to whose income will be counted when determining an individual's eligibility. If the Medicaid applicant is a tax filer, their income and the income of all of their tax dependents will be counted. If the applicant is not a tax filer, the income of the applicant, his spouse, and children will be counted. It should be noted that the children's income will only be counted if the child is required to file a tax return. If the applicant is a child, the income of the parents and siblings would be counted. These non-filer rules are also applied if an individual is claimed as a tax dependent by a tax filer who is not their spouse or parent. Additionally, these non-filer rules apply if a child is claimed as a tax dependent by a non-custodial parent. Finally, they are applied if a child lives with both parents who do not file a joint tax return. MAGI rules will not apply to all Medicaid populations. Individuals who are applying for Medicaid on the basis of being aged, blind, disabled, or needing long-term care will not have their eligibility determined based on MAGI rules. Additionally, when an income determination is not required by the Medicaid agency, non-MAGI rules will also apply. Applicants for the Medicare Savings Program and deemed newborns will also not have MAGI methodologies applied. Eligibility determination for a non-MAGI category can be triggered through multiple methods. An individual applying through the federal marketplace or through the Indiana application for health coverage may request a determination for a non-MAGI category during the course of the MAGI determination process. Additionally, the Indiana application for health coverage includes screening questions to capture potential eligibility for non-MAGI Medicaid. Answering in the affirmative to any of the disability or long-term care related questions will trigger review for potential eligibility for a non-MAGI group. An applicant is not obligated to go through the non-MAGI determination process. If the individual is satisfied with their MAGI-based coverage, they can stay enrolled in that manner. Under non-MAGI rules, the current income counting and household composition rules will remain in place. Additionally, the asset limits will continue to apply. Certain assets are excluded from what is considered a countable asset. For example, an individual's home, household goods, and personal items are not considered when determining if somebody exceeds the asset limits for the applicable program. As we just saw, institutionalized individuals have their Medicaid eligibility determined based on non-MAGI rules. In determining a nursing facility resident's financial eligibility for Medicaid, special income and resource provisions apply when the institutionalized individual has a community spouse. A community spouse is an individual who is married to an elderly, blind, or disabled institutionalized applicant or recipient of Medicaid. Community spouses are allowed to retain income and assets that are above the regular income and resource limits for Medicaid eligibility. The community spouse may maintain all of his or her personal income and half of the income generated by assets owned by both spouses. If this amount is less than $1,939, effective July of 2013, on a monthly basis, the community spouse may also maintain a portion of the institutionalized spouse's income to bring his or her monthly income up to this level. In addition to changing how income is calculated for certain eligibility groups, the Affordable Care Act also created new groups which states must begin to cover effective January 1st of 2014. The first group relates to former foster children. States must begin covering individuals who are under the age of 26 and were receiving Medicaid in the state of Indiana when they aged out of the foster care system. No income limits are applied to this group. Additionally, the Affordable Care Act implemented a new mandatory eligibility group for children who are between the ages of 6 and 18 who have income up to 133% of the federal poverty level. Prior to the ACA, Indiana had already covered this group and so will not be impacted by this new change. With the implementation of MAGI and the new eligibility categories, some eligibility categories, also known as aid categories, will change. Some have been consolidated and given new names. Therefore, consumers may see new aid category names which differ from what they see today. However, it is important to stress that these category name changes will not impact an individual's covered benefits. The next series of slides will walk through how an individual applies for health coverage and what they can expect after applying for Indiana Medicaid in the Indiana Health Coverage Programs. Beginning in October of 2013, applications for health coverage and other state benefits include the Indiana Application for Health Coverage, the Indiana Application for SNAP and TANF, and the Healthy Indiana Plan application. Applications will be accepted online, which is the recommended mode of application, by phone, fax, mail, or in person at a Division of Family Resources office. Today, applicants provide some paper verification documents at the time they apply for health coverage. Beginning in October of 2013, the state will verify eligibility information using state and federal electronic data sources. The state will only ask the applicant to provide paper documentation if there is no electronic data source available, or if what is in the electronic data is inconsistent with the information provided on the application. Applicants will receive notification via mail if additional information is required to be submitted. They should pay careful attention to the due date on that notification and submit requested verification documents by the posted due date. Presumptive eligibility allows qualified individuals to have services paid for by Medicaid pending the outcome of a full Medicaid determination. Under presumptive eligibility, the Family and Social Services Administration authorizes a healthcare provider to enroll as a qualified provider. The qualified provider asks an uninsured patient questions to screen for potential Medicaid eligibility and completes a presumptive eligibility application based on the individual's screening answers. If, upon completing the PE application, the patient meets the eligibility requirements for Medicaid, he or she is considered presumptively eligible for Medicaid. If during the presumptive eligibility application process an individual is found ineligible, he can still complete the Indiana application for health coverage to see if he is Medicaid eligible. However, he does not have appeal rights for the PE determination. When an individual is considered presumptively eligible for Medicaid, the patient gets Medicaid coverage for services during the presumptive eligibility period. They then fill out the Indiana application for health coverage. The state processes the Indiana application for health coverage, and if found eligible, their Medicaid coverage will continue. If not eligible, Medicaid coverage will end, but the provider who rendered services during the P period will still be paid for any services rendered. Today, the state operates the PE for Pregnant Women program. Beginning January 1st of 2014, in accordance with changes implemented by the Affordable Care Act, the state will also begin to operate the Hospital Presumptive Eligibility Program. Under this program, hospitals may be authorized by the state to operate presumptive eligibility. These qualified providers will determine presumptive eligibility for pregnant women. Additionally, they will be able to determine eligibility for the following populations based on income: children under 19 who fall under the Medicaid income threshold, low-income parents and caretaker relatives, the Family Planning Eligibility Program, and former foster care children up to age 26. The next series of slides review eligibility notices and appeals. After an application is completed, an individual will receive a written notice outlining the eligibility decision. Individuals also have appeal rights if dissatisfied with the outcome. Individuals will receive written eligibility notices from the Division of Family Resources, DFR. A Medicaid applicant or beneficiary will get notices whenever an application is reviewed and has been approved or denied. Additionally, a written notice will be provided whenever there is a change in coverage, which results in a termination of coverage, a suspension in coverage, or a change in benefit package or aid category. Medicaid applicants or beneficiaries have the right to an appeal when they disagree with the Medicaid agency decision. Under an appeal, they can ask the Medicaid agency to reevaluate their decision. Individuals can appeal a series of actions that have been taken by the state. This includes termination of benefits, suspension of benefits, or reduction of benefits. All notices received by the state will include appeal instructions as well as timelines for how to submit an appeal. Therefore, consumers should pay close attention to these notices to find the relevant instructions. After being determined eligible for an Indiana health coverage program, recipients will have their eligibility redetermined on a regular basis. Additionally, enrollees are required to report any changes to the state. Medicaid redeterminations are conducted every 12 months. The purpose is to ensure that individuals with Medicaid are still eligible. The state will renew eligibility without requiring additional information from the enrollee if there is sufficient information in the enrollee's electronic account to do so. If sufficient information is available to determine ongoing eligibility, the individual will be notified of the eligibility determination and required to notify the state of any inaccuracies. If insufficient information is available to determine ongoing eligibility, a pre-populated renewal form will be sent to the individual requesting the missing information. Instructions, including the due date for returning the form and any required documentation, will be provided on the mailing. You have now completed Module number 4 on Medicaid Basics. Having reviewed this module, you should now be able to assess whether someone might be potentially eligible for Medicaid. You should be able to tell a consumer what information he or she needs to provide as part of the application. You should be able to explain to a consumer their options to apply for health coverage through the state, and also help a consumer know what to expect after the application is filed.